All right, so looking at the pharmacology of Paritaprevir. All right, pharmacology of Paritaprevir. Paritaprevir. So you get to see that this drug is actually what, an antiviral drug, and it should be under the example of direct acting antiviral drug. Okay, so if you say a drug is direct acting, you mean to say that that drug actually has what, a direct action against, how will I put it? It has a direct action against the virus being able to make other copies of itself. Okay, so Paritaprevir. So let's have it so that this Paritaprevir is a direct acting antiviral drug. So it's used to treat conditions like what, chronic hepatitis C virus infections. Okay, so let's quickly look at the brief overview of its pharmacology. So for mechanism of action, for it to be able to stop the hepatitis C virus or any virus from making copies of itself, it has to what, inhibit some things that are important in the virus being able to what, make copies of itself. Again, so it inhibits the hepatitis C virus NS3 for a protease, and this protease is what, essential for the viral replication of the virus. Okay, so by blocking this protease, the Paritaprevir prevents the virus from cleaving its polyproteins into functional units. Okay, so the proteins will not be able to what, become functional units, so thereby it will disrupt the viral replication. Okay, the virus will not be able to make copies of itself. If a virus is not being able to multiply and make copies of itself, it will not be able to affect you like that. Okay, so what is the effectiveness of this drug? It is effective against what, hepatitis C virus genotypes 1, 4, and 6. It is often used in combination with other antivirals like what, umbitazvir, dasabuvir, and ritonavir. Okay, so you can see this one is a drug also known as what, Viekirax, which is a combination of what, umbitazvir, Paritaprevir, and what, ritonavir. All right, so it's usually used in what, combination. Okay, so the combination is known as what, Viekirax or Techni V. Okay, so what is the pharmacokinetics? Paritaprevir reaches peak plasma concentration within 2 to 4 hours after oral intake and has a terminal half-life of about 5 to 8 hours. Okay, it is primarily metabolized by the liver enzymes known as what, cytochrome 3A4. Now, when co-administered with ritonavir, its half-life is extended and its exposure is significantly what, increased. Okay, so what is the administration? Is typically taken once daily with food to enhance absorption. Side effects: if you are taking this drug, you can be expecting things like what, headaches, fatigue, that's weakness even after you have rested, then nausea. Right, so it should be used with caution in patients with hepatic impairment. Right, so looking at this is actually the biochemical structure. Right, that's the biochemical structure. Okay, so the drug, it's how the drug looks like. Okay, so that's E for what, Paritaprevir and its pharmacology. Bye for now.